Lola has a serious head wound. She could also have other internal injuries that aren't immediately obvious. Dr. Andy and Alistair are briefed on the casualties by the operations manager.
Fine. Yep.
Head laceration.
Yep.
Okay. A little bit being unresponsive at times,
Okay.
very distressed.
All right. Okay, fair enough. And how many people we got in total, mate?
So 5 in all.
Yeah.
Yeah.
Essentially 4 walking wounded as well.
Fine.
Dr. Andy's priority is to examine the most seriously injured person, a 6-year-old child.
Hello. Oh, you're holding a patient. Hello. All right. Okay.
A 6-year-old female. She was in the 3rd row of the black car.
Okay.
Booster seat belts on. By the look of it, head's hit the plastic tray and the chair in front. Unknown of loss of consciousness, but instant blood coming from the wound.
Yeah.
Roughly
Okay.
30 mil.
Lola was travelling home with her brother and sister from a martial arts lesson. She was strapped in the back of her mum's car when it collided with another vehicle.
I'm sorry.
Yeah.
Fortunately, the other 2 children escaped with minor injuries.
So I guess the question here is, where's Mom or Dad?
Outside on the left there.
Okay.
So I've just come out of sight for a minute because she was getting quite upset.
Although Mum has also been injured, she is staying close to her daughter.
We are alert, however, we are having increasing periods of
Drowsiness. Okay.
Really unable to do a blood pressure. The only thing I've been able to give you so far is a reference of about 28 initially.
So do we know if there's been a loss of consciousness or not? We're not sure.
know.
Okay.
Lola has a serious head wound. Her intermittent drowsiness is a cause for concern. She may be in shock. She could also have other internal injuries that aren't immediately obvious.
Yeah.
So I think the plan we're going to do in a minute, folks, we'll get back to the helicopter ready. It would be lovely to immobilise her, but I think actually if we just pick her up as we are and we walk up the road to the field, wrapped up in a blanket, onto a scoop when we get to her.
Before they move her, Alistair checks Lola's head injury, which is still bleeding. A large piece of skin has been torn away, exposing underlying tissue.
Let's get this old one off.
All right, my sweet.
Is there...
As the shock wears off, Lola is becoming increasingly agitated. Alistair is concerned she may have other injuries.
Lola?
What?
Does that hurt on your arm, my darling? It does hurt on your arm. Okay.
Is it time to go home?
Oh, nearly.
I want to go home.
We're going to see the doctors. Let's take...
All right. I think that's the arm.
Dr. Andy wants to fly Lola to hospital in the air ambulance, but first he needs to clear it with Mum Jenny, who was driving the car.
We just had a look at a little one there. She's okay. I'm not overly concerned, but she's got quite a nasty cut to her head and she's a little bit sleepy. I think because of that, it wouldn't be appropriate to take her to the local hospital here. I think she needs to go to somewhere that's a bit more specialist, like the Children's Hospital. Now, that's quite a long way, so what we're probably going to have to do is pop her in the helicopter and fly her. The advantage of that is that it's the best place to sort her out. The downside is we can't take you with us, unfortunately, because we can't get you in the helicopter and it's not an adult hospital. So that means we're going to have to take her if you're happy with that. Is that okay? I know, I appreciate that, but I think it's probably the best thing for her. If she gets really agitated, we can always give her a bit of medication to calm her down and relax her. And again, that's not an uncommon thing that we might need to do. But like I say, she's got a nasty cut, and I think the best place for that to be sorted is at the Children's Hospital, rather than at somewhere that doesn't deal with it quite as often. Is that all right? Okay.
It's 6:30 p.m. and starting to get dark. This restricts which hospitals the helicopter can land at.
So if we can do Alder Hey in less than half an hour.
Okay, yeah.
It's just giving us a distance to Alder Hey.
Fair enough. Okay.
Just because if we can go straight there.
Dr. Andy is weighing up flying to Liverpool, home to one of Europe's biggest children's hospitals, Alder Hey. It has the advantage of a lit helipad.
Shoulder may be dislocated. The seatbelt bruising now coming out on that shoulder, and she's screaming when I touch it. So we've got the head laceration and plus shoulder injury.
Do we need to do anything about it?
No, I think we'll be able to pick her up and carry her quietly, but it's whether she's then going to cry en route, and we need some pain relief.
Hello, I'm sorry. I'm sorry. Listen, we want to give you something to make you a bit less sore.
The ambulance crew reverse up the road with Lola to the waiting helicopter.
Oh, You'll be all right, Lola. So if we come to the back, yeah, we're going to have a lie down.
Okay, Lola, it might be a little bit cold, okay, sweetie?
I don't want it to be cold.
Oh,
I want it to be warm.
we'll warm you up in a minute, Lola. Stretch legs out. Lola. Lola. It's all right, my darling. It's all right, trust me. It's all right.
Okay, Lola.
So we're going to just move this a little bit further. So there. And then, because you were cold, we're going to wrap some stuff around you.
On the journey, Dr. Andy notices that Lola's become less alert. This is measured on a GCS scale based on her ability to talk, move, and focus her eyes. A normal score would be a GCS of 15.
03, just I wonder if you could pass an update to older hay for us. This girl's GCS has just dropped to 13 during transit. No other changes. I don't think it represents anything to worry about. Possibly developing a little bit of periorbital bruising as well, though it's difficult to tell given the light conditions. But I think it's probably worth just updating to make sure they do have anaesthetic cover down there in case of a rapid deterioration. Over. But our main concerns with Lola are that she's bumped her head and she has got a little bit sleepy. That could just be the environment she's in the back of the helicopter, but it could also be something going on inside her head. So we're keeping a close eye on her on the way. Our main concerns would be injury to her brain, but she's also injured her shoulder as well.
Arriving at the helipad outside Alder Hey Children's Hospital, Alistair and Dr. Andy hand Lola over to the paediatric trauma team for ongoing specialist care.
Somebody's had the car crash. He's lost control of the tree. His car's a rotor. Can you see whether they are breathing? They've got his breathing, but he's out of it. Is he responding to anybody? No.
So, multiple patients. Sounds like we've got at least 2, and a male. Sounds like they're still in the vehicle with a bleeding abdomen. I think this gentleman's got potential to be unwell.
On their arrival, police and ambulance are already on scene. One patient, the driver, has just been released from the car.
If you're happy, just continue to the back of the truck and we'll meet you on there. I'll take a look at the car. All right.
He was conscious once the passerby got to him, and they pulled him out of the car, placed him in the recovery position.
The operational commander briefs Matt on the incident.
He's jumped a fair way up that tree, hasn't he?
He really has. So it is a fair way up, and there is quite a bit of passenger space intrusion.
Yeah.
They did pull him from the driver's seat, so his side was quite free.
Right, cool.
With the driver now on the ambulance, Matt begins assessing the extent of his injury.
Give my hand a squeeze for me. Good. Can you stick your tongue out for me? Squeeze this hand.
20-year-old Khalil, a restaurant cashier, was driving home from work when he lost control and crashed into the tree.
So unconscious with passerby then, he pulled him out, but then like this with you guys when you got here? Yeah.
When he first got there, eyes were closed.
Yeah.
As soon as he moved at all, track open eyes, track underneath, no response at all.
Khalil is agitated, but not responding to any commands.
Sit still for me, all right?
Keep your head down. Good man. All right.
Jack inspects the car to get a better insight into what injuries Khalil may have sustained.
So significant passenger space intrusion. Driver space looks all right.
The windscreen has a clear imprint where Khalil's head smashed into it.
Airbags have been deployed and it's clear that the seatbelt was not being worn. It's still fastened, so he's been sat on it by the looks of things.
All the indications are Khalil has sustained a life-threatening head trauma.
I haven't got you a full GCS breakdown, but it's safe to say he's not a GCS 15. It will probably either be the QE. We're just getting him on the back of the vehicle and sorted out. We'll come back to you with some obs and a plan shortly, not behaving normally. We're going to sedate him slightly, but it might be that escalates to a full anaesthetic. But I'll come back to you with full details in a little bit. Received. Just relax, mate. Just lie back. Yeah. Lie back.
All right? Keep your head down for me.
You can see from the vehicle that all the impacts were taken on the passenger side, which is probably the only reason he's still alive. Although he's not been wearing his seatbelt, so he's clearly been thrown around in the vehicle. We can't see anything obvious in terms of fractures or huge wounds, but his behaviour is certainly not normal. Potentially consistent with a head injury, like a closed head injury.
So we're going to give him a bit of ketamine, just see if we can get him chilled out a bit.
Yeah. Okay.
If we can't get adequate control of some ketamine, then we'll put him off to sleep.
Oh, sit still for me. Good man.
You smell any alcohol at the top end?
Maybe.
No.
While giving the ketamine sedative, Matt and Jack discuss his coma scale assessment.
So GCS-wise, we are probably an E3,
Yep.
V1,
Yep.
motor,
And then
5 probably, 2 localised.
Khalil's score is on the border between moderate and severe brain injury.
He's had a fair impact,
Oh, it's massive.
enough to shake his head around. Can you give my hand a squeeze for me? Just squeeze my hand. Good. So yeah, he obeys commands. So if you're happy, I think we just go.
Yeah, yeah.
Airway-wise,
secure.
he's all right, isn't he? He's oxygenating, he's ventilating well. As you said, whether he's a bit shook up because he's had his brain rolled around his head, I think if you're in agreement, I don't think we should RSI him at the moment and just...
His airway's very patent, it's not maintained.
Just a little bit of ketamine if he gets unmanageable again, and 20 seems to have worked the trick.
Yep, sounds good to me.
The ketamine has relaxed Khalil, enough to ensure he's safe to travel to hospital.
60.
Yeah, go ahead.
So we're going to be escorting to the QE with an approximate ETA of probably about 20 minutes. So.
Yep, that is all received. I'll give them a shout for you.
Khalil is still in a life-threatening condition, so both Jack and Matt stay on the ambulance to closely monitor him, ready to intervene on the journey if necessary.
You give my hand a squeeze for me? Good. All right, well done.
He will open his eyes for us.
Yeah, so we're going to take him into resus at Queen Elizabeth Hospital. He'll get assessed by their trauma team. They'll reassess his airway, breathing, circulation, and then he'll probably need to go for a CT scan of his head and any other bits of his body that the team feel appropriate when they have a look at him.
Two cars have crashed on a residential street. Ambulance crew are treating a man found lying in the road.
So drive around this car.
Yeah.
Apparently he's up and walking around.
Okay.
Said she's happy.
Operational manager Chris Bayliss, overseeing the incident, briefs Ian.
And this guy who's like flat on his face.
Yeah.
Apparently he's got out of that car at the Civic.
Yeah.
He's walked 2 spaces and collapsed.
Right, okay.
Apparently he's got some pelvic pain.
Right.
He's had previous fractures to his spine, etc.
Okay.
It's got he's talking to him.
33-year-old Aaron was driving when he was in a head-on collision with another car. He is now complaining of back pain and a loss of feeling to his left arm.
Hello, guys, you all right? What do I call you, buddy?
Aaron.
Aaron, my name's Ian. I'm one of the other paramedics been sent. All right, I know the guys have been to you. Do you remember what happened?
Yeah.
Yeah. Take a deep breath for me, mate. Okay, yeah. I'm not pushing hard, mate. There we are. Yeah. Wiggle your toes for me. And can you just... You can feel your toes? Okay, so what happened to you before? What have you done to your back? What happened?
I broke my L2 and L3.
Yeah.
And last year, I was in the coma for 5 days as well.
Last year? Okay. All right.
Having previously suffered a brain trauma and with recent major spinal surgery, Aaron is worried he may be paralysed.
This one?
No, my other arm.
Okay.
I can't feel it. Yeah, completely numb.
Can you move that arm at all?
No, I really feel my left arm.
Hey.
33-year-old Aaron broke his back 3 years ago and had extensive spinal surgery.
I just thought, get something ready for that arm. Does it look hugely deformed, or? I had a quick feel down. He's got good bilateral entry, he's got a stable pelvic ring, and his legs are intact. Just relax. You haven't got a spinal injury, okay? You haven't got a spinal injury. Yeah, that's fine. Good skills, all right? We are going to have to roll you to get you on a scoop, though, okay? So we can have a better look at you, all right?
Whilst Aaron is given pain relief for his injured hand, Ian checks for any more serious injuries, including nerve damage.
I'm just going to gently touch down your legs. Just let me know what you can feel. Just say yes, all right?
That's all fine.
Yeah. Okay. And this one?
I know you're touching it.
Yeah. Okay. All right. Yeah. Don't worry. That's fine. Now listen. You have not got a spinal injury. It's whatever's happened to you before is not the same as today. Okay. All right. Yeah. Okay. Slow, deep breaths. All right. You are going to be fine. We'll get you some pain relief. You may have hurt that arm, and we'll get that sorted for you. All right.
Ian is confident that Aaron is stable enough to be moved into the ambulance.
Aaron, I'm just going to move this arm gently up, okay? We're going to literally... There you go.
That's it. Just be careful of that in your arm.
So have you got the head?
Yeah, on your shout then. It's best I can. Yeah.
Let's go slow, please.
Yeah.
Breathe. You've got to breathe. Okay, nice deep breaths, yeah?
Yeah.
Okay.
I'm ready. You're calling.
You're calling.
Okay, ready, steady, roll. Well done, well done.
There you go, relax. Yeah.
No, you did great.
Aaron, you're a legend. Well done, man. All right. We're going to get you up off the floor and get you in the ambulance.
Yeah, I'm calming down.
Yeah, that's okay, mate. Hey, honestly, mate, you've been in an accident. If nothing else, you've been in an accident, okay? So don't stress about it, mate. Okay, on lift. Ready, steady, lift. There you go. I think given to how well Aaron is now, you know, he's obviously got to go and get x-rays and anything else they need. But yeah, mate, don't. Mate, with your history, that is fully understandable, mate, yeah? Don't worry. Of course you do. Don't worry. Right, they will take care of you. Happy, guys?
Yeah.
Thank you very much. We'll get out your way. All right, take care, cheers.
In Wolverhampton, critical care paramedics Richard Apps and Alistair McNeil are treating a 19-year-old woman who's been involved in a road traffic collision.
You have that lady there, right, and then we'll put this one with the aircraft crew.
While the Helimed team focus on the male patient who's already in an ambulance, Rich and Alistair turn their attention to the female.
Hi all. Oh, electric scooter. Both occupants of the scooter? Right.
19-year-old Shante had been riding with her boyfriend on an e-scooter when they collided with a car. Neither were wearing helmets. Shante struck her head in the impact and has also sustained injuries to her legs and arm.
What have we got so far?
No obvious C-spine, spinal pain, injury. Says she can't feel her legs, but she's moving. Blood pressure did drop a minute ago, but that's stabilised at the moment. Keeps going between agitated, unresponsive. At the moment, she's calm, she can hear us.
Yeah. GCS?
GCS.
Rough or AVPO?
It's kind of 15.
She's talking to you?
Yeah.
Although she's now conscious, Shantae's condition is critical.
And blood is coming from, do we know?
Mouth, we've got a wound to the mouth, wound to the ear, big wound to the left arm, quite a nasty wound to this elbow, possibly down to the bone, as best we could see.
Okay.
While a Helimed team leads the treatment of her boyfriend, Rich and Alistair are focusing on Shante.
Can we get the oxygen back on, or was she not?
She threw it off a minute ago, yeah.
Let's just put this oxygen mask on you.
She has injuries to her legs and mouth and a deep cut on her elbow.
You happy there's enough of us to lift without straps?
It's got one on in
One on, that'll do us, won't it?
Rich and Alistair want to get her into the ambulance as quickly as possible.
Okay, don't worry too much about her head. If she's, just tell her to keep it still for now. Happy that we're going to fold up. Just get rid of this. Okay.
We're going to get you onto the ambulance.
Get her to keep her head still.
As a result of her head injury, Shante is confused and tells the paramedics her name is Charlene.
Charlene, can you just ask her to squeeze my hands, mate?
Will you just squeeze the gentleman's hands for us, Charlene?
Yeah, so obeying commands.
Charlene, your eyes for me. That's better. Keep talking to me, sweetheart, yeah?
Shantae's conscious, but in a lot of pain.
Really important. I know it hurts.
While Shantae's cuts and lacerations are clear to see, it's the possibility of internal injuries that's giving Rich and Alistair cause for concern.
Charlene, what's hurting?
The second doctor-led Helimed team has arrived to help.
Have we had any treatment? No, X-ray, nothing?
She hasn't had X-ray yet. Literally, we haven't got IV yet. Got a vein this side. Charlene, keep your arm still for me. Where are your tourniquets? I will need a tourniquet, but just press the BP cuff.
Alistair inserts a cannula into Shantae's arm, so the doctor will be able to give drugs intravenously.
I'm going to need a bit of gauze here. Sorry, mate. 10 mil flush, very nicely. Lovely.
You did a BM?
Don't think anybody will have done a BM yet.
The BM kit measures a patient's blood sugar levels. It's used to help build a picture of their overall condition.
Sorry. Where are we?
BP is on cycle, guys.
OK, we've got 9.4 as a blood sugar, people. And a BP is 97/48.
She's quite a slight lady, isn't she?
Yeah. Cannula that I've just flushed for you.
Fluids are ready to run.
With Shantae now prepped for the journey to hospital, Rich and Alistair hand over to the Helimed team.
Anything else you want, guys, before we dismiss?
Or do you just want to do stuff on the way?
Yeah, come on, by reactors, then we'll start rolling.
Yeah.
As the helicopter had to land some distance away, it's decided the quickest option is by road.
OK, see you guys.